Hello everyone, welcome to Let's Crack UPSC CSE English. About me, I am Sandeep Bhushan Thummala and my credentials are I have 8 years of teaching experience for civil services. I teach international relations, internal security and in-depth analysis of Hindu editorials and articles, which will be very important in regards to trending topics. I would discuss for the benefit of the civil servant aspirants, which will be useful for the prelims and also for the mains point of view in regards to factual and also analytical point of view. And then this video is in regards to how to crack prelims and mains 2020. But prior to that, you have a UPSC Let's Crack UPSC CSE English notification, which is India's largest learning platform. And upon subscription, you will have live and recorded courses from India's best educators. And you will get the privileges, that is daily live classes, live test and quizzes, structured courses and unlimited access to the live and recorded courses. And these are all the top educators which you can see it on the screen. And in regards to Let's Crack UPSC CS English, you have the courses like economy, geography, current affairs and various others, which you can also see it or view it on your screen. And in regards to the other courses in Let's Crack CSC, UPSC CS English, it is essay writing, practice and strategy, social issues, interview preparation and others. And in regards to subscription, you have 12 months and then for 24 month subscription. 12 months, the actual amount is 40,000 and the 24 month subscription is 48,000. So it's always recommended to go ahead with 24 month subscription, that is Let's Crack UPSC CSE English subscription for 24 months, wherein the original price is 48,000, and you can use my code, that is Sandeep Bhushan Thummala 10, and you would get 10% discount and the discounted amount would be 43,200. And you will get the privilege, that is you will be paying effectively for the amount for 13 months, that is 12 months, which is 40,000, 1 month it is 8,000. So combined together 12 plus 1 is 13 months, which you will be actually paying 48,000 for 13 months. But for 24 month subscription, you have the opportunity that you can just pay for 13 months and then get the subscription for 2 years, and using my code SBT10 you will get 10% discount and the discounted amount would be 43,200. So it's always better go ahead with subscribing with 24 months and then take the maximum benefit of getting into the preparation for civil services or UPSC examination, which you require 2 years of the 24 months solid preparation. And in regards to the topic, that is I would go ahead with the trending topic of the Hindu newspaper, and prior to that I would say hi to all the viewers who are watching it. And today we will be talking about or discussing in regards to the trending topic, which is the point or how the Taiwan has really handled the issue in regards to the COVID-19, how Taiwan has handled the issue very effectively. Because if you look at after Wuhan, Shreya Joshi has joined. Hi to Shreya. Hi to you, Shreya. And the topic what we will be discussing is how Taiwan has handled this situation in regards to COVID-19. Because once the SARS-CoV-2 has hit the Wuhan city, the epicenter, and then later on we have seen the Southeast Asian countries were badly hit. Next is the Southeast Asian countries. So when the Southeast Asian countries were badly hit, there was, what do you say, we have seen Taiwan, which has badly hit, we have seen Hong Kong, we have seen Singapore, fine, and then we have seen other what do you say, the Southeast Asian countries which have been badly hit. But at the same time we have seen how Singapore, Hong Kong, Taiwan have effectively handled the coronavirus or the spread, or did they try to contain the spread of coronavirus is very important. So we will look at the country which has tackled the COVID-19 very well, that is we will look at the country, that is Taiwan. So Jahnavi has also joined. Hi to you, Jahnavi. Today we will be discussing about the topic or the trending topic in regards to that, how the Taiwan has handled effectively the COVID-19. So today's article which talks about Taiwan's coronavirus protocol. So we will look at Taiwan's coronavirus protocol. What protocol Taiwan has implemented, and then how they have overcome the coronavirus. How they have overcome the coronavirus. So Anup Srivastava has joined. Hi to you also, Anup. Hi to you. And the rest everyone who are watching the video, the class, the session also, hi to everyone. And then we will look at the Taiwan's coronavirus protocol, that is the protocols which have been taken up by Taiwan or the Taiwan country. It is in regards to the health ministry also, the health ministry, how they have health and welfare ministry or minister or ministry together have handled this with various protocols, and we will look at Taiwan's coronavirus protocol and how this has really worked out and how it has been a success, and we will also look at what is the role of Taiwan in contributing to the WHO, in contributing to various countries and also to WHO, and then making sure that Taiwan, even though it is not part of WHO, but at the time of COVID-19, at the time of the pandemic situation, it has really helped all other countries in making sure that all other countries would follow the protocol what Taiwan or other Southeast Asian countries have followed. And then in regards to ESS, GISAD, yes, I will look at it. I will definitely go ahead with that, Pratham. And then in regards to how Taiwan has made sure that it has passed on all the information in regards to SARS genome sequencing to WHO, even though Taiwan is not a member of the WHO. So we will look at all that how Taiwan is, what do you say, really helpful, even though it is not part of WHO, and what protocols it has taken into consideration, and how it has really been an effective measure to contain the spread of virus and then overcome the pandemic situation. We will look at Taiwan's strategy, we will look at what technology it has actually taken into consideration, and how Taiwan has actually helped various other countries by linking beyond what you say Southeast Asia and then even to Europe also. Fine. So we will look at all this, which will be very useful the way we are going ahead with daily a trending topic, and today's trending topic is Taiwan's coronavirus protocol. And then Pratham says yes. Pratham, hi Pratham. Someshwar Sharma, good morning. Hi to you, Someshwar Sharma also. Very good morning to you. And Taiwan's coronavirus protocol, if you look at, Taiwan is not experiencing the SARS-CoV-2 or the COVID for the first time. Is not experiencing COVID-19 for the first time. Not for the first time. We have seen in the past also the pandemics have spread rapidly around the world, and then we have also seen that how it has impacted various countries also, that is in regards to even China or even regards to South Asian countries. So definitely there is a kind of lessons what Taiwan has also learned from the previous viruses which were part of the pandemics. Yes, definitely Pratham. So pandemics, definitely it will spread very rapidly across the world as we are experiencing it. We have just heard about it, we have read about it in the past, but for the first time even we, I mean the Indians, have also experienced how the pandemic can spread very rapidly across the world, and that is because of the international transportation. One of the point is international transportation, or people, what do you say, moving from one country to, or else moving across the globe, all the countries. And the other one is in regards to the globalization. Fine. You can also take it into consideration of trade, globalization, tourism. All these are the factors how the pandemics are rapidly spreading, because it is ease of international transportation. That is the way we are just trying to move from one place to another place, that is country or continents itself, within no time. And that is actually making sure that we have seen various examples how the pandemic is spreading very violent. We have seen the Spanish flu in the year 1918, we have seen SARS in 2003, H1N1 in 2009. So these are the examples what are that the pandemic spread very violent, and we should not be complacent enough what we have what the previous or the countries which have experienced it or been part of the affected countries, they should not be complacent enough, because pandemics are the one which are repeatedly emerging, and the virus are the, I mean, diseases from the virus pandemics are repeatedly emerging. So we have seen the SARS, Spanish flu, and then H1N1 in the year 2009, and these are very important in regards to, again, Prince point of view, match the following: MERS in the year 2012, Ebola in the year 2014, and then Zika virus in Central and South America in the year 2015-16. So this is what is very important. Someshwar Sharma says, which country is affected by SARS-CoV-2? It is first China, and then again Southeast Asian countries. It is China and then Southeast Asian countries. Somesh, I think you are getting it. China and then Southeast Asian countries have impacted very badly, even by the SARS. And then MERS is the Middle East countries, because it has been part of the bats and also the camels. Ebola, definitely it is in regards to the, we have seen part of the bats, and then Zika virus is also part of the bats. Fine. So we know this, all this, what is happening is a process called as zoonosis. That is from the animals are the source. Animals are the source for the virus. That is what we are talking about. The initial or the ancestor virus is SARS. From SARS it is changing. From SARS it could be MERS, it could be SARS-CoV-2 now. So it is keeping on changing. But the ancestor, the virus is SARS-CoV-2. Fine. SARS. Actually, so SARS. It is SARS. I think Someshwar, I think you have got it. And today we have seen that what it has really, the epicenter being the Wuhan, what we have seen in the end of, or else December 2019, and then how it has gone ahead with COVID-19 spreading, or it has become a global pandemic. So before getting into the Taiwan's coronavirus protocol, I thought it is very important that we have to get into this. We need to know how Southeast Asian countries, along with the West, what do you say, African countries, have been affected, by the, even along with the, what do you say, Zika, even in regards to even Brazil also, it has been affected. So in regards to that, yeah, due to mutation, it is keeping on sequencing. Its genome sequencing is what do you say, very fastly it is changing. That is mutating. Reboot domain. Yes, we are talking about the audio. I mean, the way the spread of virus do take place. So we have seen, as you are, I mean, Someshwar asking about, sir, 17 years back, what has happened is this SARS. Even it has hit the Southeast Asian countries, and Taiwan also was part of it, was also part of the infectious disease. So definitely, what in 2019-20 in regards to the COVID-19, we do not have much of experience, but definitely the Southeast Asian countries do have experience in handling the SARS, to have experience in regards to handling the SARS. So definitely, as I was talking about the various Southeast Asian countries in regards to Singapore, Taiwan, Hong Kong, and then even Malaysia, how they have tried to cope up with the at the initial stage itself to break the transmission of the COVID-19. And that is what you say, its strategy initially to take up that, its experience of what SARS go to 17 years back, that is 2003. And then it immediately, what the strategy it has gone ahead with. First one, it began implementing onboard quarantine itself. See, this is very, very important. Onboard quarantine itself. Not when, what do you say, they come to, or they get into particular country or place, and then later on they will be quarantined. No, by that time the virus will definitely spread once they get into the airport, and then from there to the respective, what do you say, cities and then towns or districts, the virus is definitely would spread definitely. And then you never know the travel history. The persons with the travel history may or may not be part of the quarantine camps, and they would be freely moving in this society. When they are freely moving in the society, definitely the spread of virus do take place. What is the transmission procedure of these epidemics? Transmission procedure, it transmits everywhere. What I mean, what is that you are wanting to know, so much procedure, in the sense this transmission takes place very fast. So that is why it takes place so fast, and then it happens between what you say just 12 to 14 days. The incubation period is for this COVID-19. Incubation period is 12 to 14 days, and within these 14 days it will keep on spreading, because the one who is infected also doesn't know that he or she is infected. The person would be as healthy as everyone, and but unknowingly the spreading of virus do take place, the transmission do take place, and the transmission is taken place at a very faster pace, which the one who is infected doesn't know, and the one who is healthy also doesn't know the virus is being spread. Only they will get to know, or they will have that symptoms only after 12 to 14 days. And there are many cases that the persons who are also having some kind of mild symptoms, they always tend to have these asymptomatic cases. So definitely they have gone ahead initially with the onboard quarantine of the direct flight from Wuhan to Taiwan right from the day when the outbreak was in the Wuhan. So definitely right from December 31st itself 2019, whoever was having the travel history from Wuhan to Taiwan, so they have gone ahead with onboard quarantine. This is very important. And the second one, what strategy they have gone ahead is, they have established, second one, response team. They have established the response team for the disease and activated. This is very important, establishing a response team, as India also has this, what do you say, the task force. Initially government of India under the prime minister, when he has gone ahead first time, he has said that he'll go ahead with the task force after the Janta curfew, when he was announcing the national lockdown. So task force is there, response team is there, definitely. Likewise, they have established a response team for the disease, and they have activated the Central Epidemic Command Center, CECC. This is very important. The CECC, one of the strategy what they have done is the CECC. The third one you can take it as activating the Central Epidemic Command Center on January 20 itself. Look at the way it was not really waiting for the virus to actually infect, and then the persons would be with the symptoms. No, immediately as a level 3 government entity. Look at this, as a level 3, and upgrading it to level 2 and then level 1 by January 23rd, and then February 27th. So look at it, at different levels they have come up with a Central Epidemic Command Center. This is a command center, or you can talk it as a, what is a central agency also, or else task force kind of thing. And then they have come up with different levels, level 3, level 2 and level 1. And level 3 right from, what you say, January 20, and then again immediately the level 2 was in the after 3 days, January 23, and then again February 27. So why are we talking in regards to this level? These are the strategies how they, what do you say, the Taiwan has taken into consideration, that how effectively they can break the transmission of the virus, that is COVID-19. So they were very effective in regards to their strategy what they have implemented, and definitely that is because of the experience they have in regards to the SARS outbreak in 2003, that is 17 years back. So what is important here is establishment of a response team, and then the activation of the Central Epidemic Command Center. Yeah, Pratham has written, should India have a state-wise NDCM in line with the Central Task Force, and NDCM on same line with as CECC as in Taiwan of 11? Yes, see, definitely in regards to India, you have the health. We will take first as PM or PMO, fine, and then you have the health ministry. In association, you have the, what do you say, home ministry also, home ministry, and then you have under this you have ICMR, fine. Again, various state health ministries also, state health ministries also work in tandem with ICMR, and again with PMO it is the state chief ministers. So we do have a system in place, but definitely the Southeast Asian countries, and our focus in regards to Taiwan's coronavirus protocol and the strategies, yes, they have a structured one, because they all are having the experience, and how they can contain the virus within very short period of time is very important. And look at the way we are also going ahead is, we are going ahead, but we are focusing more on national lockdown. They have focused on quarantine, they are focused on testing, they are focused on central epidemic command center, which looks into the quarantine and which looks into the testing process. And then the central epidemic command center, what is the job of it? It effectively integrates, so you can take it as fifth one, it effectively integrates resources from various ministries. That is what you were asking about, Pratham. Because as I said that yes, we do have PMO and then health ministry, and then you have the home ministry which is also looking into it, and then you have the ICMR, fine, again state health ministries, and then the chief secretary of the state chief ministers, coordination with the prime ministers. So definitely there is also kind of what you say CECC, that is Central Epidemic Command Center. What is the importance of it is to integrate resources from various ministries. Here we were talking about health ministry, and we are talking about home ministry. These both will have in tandem with the PMO or prime minister office, fine. But here from various ministries, the central epidemic command center, this is very important. This is a command center for what? Epidemic. Central epidemic command center will integrate, this is a keyword, will integrate resources from various ministries and invest itself as a fully containment of the epidemic. So it is taking, so you can see this photograph, you have this central epidemic command center which works in regards to making sure that they coordinate with various ministries in making sure that how best they can try to contain the virus, and how they have to go ahead with the quarantining and then testing, and then making sure that they are, many of the patients are recovered, and then this would be making sure that the virus would gradually move out of the country. So on April 9th, again if you look at, the Taiwan has gone ahead with testing. As I was talking about, one of the strategies that again looking into this and then making sure that testing is taken into consideration. And they have tested the numbers what they have given. And then if you look at, only 5 deaths. Despite its proximity to China, Taiwan ranked 123 among 183 countries in terms of confirmed cases per million people, 123. But still, it did try to contain it very fast because of the Central Epidemic Command Center, what it has. And I'm saying this is very important for prelims point of view. Central Epidemic Command Center for prelims and also mains point of view. While you are writing an answer, quoting the example of the Southeast Asian countries, or else taking yesterday's point, we were talking about the pandemic patent pool, and then again in regards to the Taiwan's coronavirus protocol, link both of them, and then you have the CECC, that is Central Epidemic Command Center, in your answer. It will be very impressive, and it will be impressive. Why? Because it is your own answer. And that is what my lecture will definitely make you enhance, making sure that you will come up with your own answers with the creativity, not from any other material. And these have shown Taiwan's aggressive efforts in containing the epidemic. So whatever we were talking about, all these points, we have made really the Taiwan handling the situation effectively and in a stricter measures by not much of lockdown. Yes, they have gone ahead with lockdown. Along with the lockdown, they have gone ahead with quarantine, testing, and then having a CECC in place, that is in regards to the Central Epidemic Command Center. Okay, Pratham says that since our structure is lengthy, hence delaying our decision implement. One thing is very sure, geographically we are higher geographical location. I mean the map we have, that is in regards to the area, and then in regards to the population also, 1.33 billion population. Definitely it will take little time. We are focusing on the country which is geographically comparatively less in size area wise, and also in regards to the population wise. So we will definitely, I mean India has to definitely learn from the various countries, the way it has effectively handled the spread of virus, or it has effectively broken the transmission of the virus. And then we will look at the how Taiwan has connected technology in containing the virus. Pratham said there is no unidirection approach by India since no single body to control epidemic pan India. Yes, definitely there would be, what do you say, slowly situations will change, and then we would also have this kind of, what do you say, a command center. So Taiwan has implemented dynamic plans. This is again the first one when we are talking about the technology, how it has improved, or it has gone ahead with harnessing or connecting the technologies, making sure that the spread of virus do not take place much, or the mortality rate and then the morbidity rate and then the mortality rate will be very low. Morbidity in the sense infected persons, and then the death cases will be very low. They have taken or they have implemented the dynamic plans concerning the border quarantine measure. This is very important again. Border quarantine measure. They have gone ahead with onboard flights, onboard quarantine itself, and they have also gone ahead with border quarantine measures. How? Again, I was talking about onboard, and then very fewer screening, health declaration, that is, and every 14-day home quarantine for passengers arriving from nation. That is, whoever have the travel history, have the travel history, they have to go out with 14-day quarantine and then arriving from nation, and then they are under the level 3 warning system. So look at, they did not immediately, what you say, just have the travel history patients as in India in the airports. Yes, they have gone ahead with the thermal screening initially. I'm talking about initially only thermal screening, and then they were left to go to their respective houses, and then probably many of them have spread the virus unknowingly. And then Taiwan has also established an electronic system. So I can take this as A under 1 and then this as B. So it has established an electronic system for what? Entry quarantine, which allows passengers with a local mobile phone number and fill in health information using a mobile phone. So can you connect this something to India? What it has? Geofencing. This is an app. Geofencing is an app. In regards to India, what we are talking about, the electronic system of Taiwan, the way the Taiwan has gone ahead with passengers taking the local mobile phone number and to fill in the health information using the mobile phone. So that has created a kind of using the technology at most. So even India has gone ahead with mobile fencing. This is used for COVID-19 quarantine alert system. Please do understand this. COVID-19 quarantine alert system by concept called as geofencing, and also you have the Arogya Setu app. So India is also into that in regards to, but here it is, they have to fill in the health information using the mobile phone. So that latest technology is little bit health national health insurance card containing travel historic. Yes, and health declaration pass. This is the third one, which will be sent to them as a text message. So they have the health declaration, which they will be having a pass, but is called as health declaration pass, and they will be sent to them as a text message, and this is connected to community care support management system. So this is again, this card, declaration card, health declaration card, is linked to community care support management system. Community care support management system. So look at how they have linked it to the health declaration pass to community care supports or management system, which allows government agencies to provide care services and medical assistance. So thereby, why they have gone ahead with this health declaration pass and then linking it with the community care support system, that means the one who are having this pass will be under the government scrutiny. Fine, and then they would be tracked by the electronic system, whether they are part of the quarantine system or whether they are having any kind of, what you say, symptomatic symptoms or in regards to the COVID-19. So by the technology, they did try to go ahead with containing the spread of virus. That is very important. The first one is border quarantine measure. Part of it is onboard quarantining, and the second one is using or establishing electronic system, and the third one is going ahead with the health declaration pass, which is connected to community care support system management system. So all this is what to keep a track of the one who is having the travel history, and the travel history of the individuals is stored in national health insurance card. Again, this look at, see, you have this health declaration pass, you have the national health insurance card, and along with this you have again what we are talking about, community care. We have said this community care support management system. So you have the community care support management system. Fine. So this first is in regards to health pass, what we were talking about, health declaration pass, and again in regards to having national health insurance card to alert the physician the possible cases and prevent community transmission. So look at the way the strategies the Taiwan government has taken, implementing or harnessing or connecting it with the technology. That is very important. So not only just having the national health insurance card, that they are having this data, and this through this data the physicians or else the doctors or else the concerned authority will make sure that they will get the data, they can prevent the community transmission. So the preventing, they were effective in breaking the transmission, the chain of the transmission of COVID-19. And for the one who are going the home quarantine isolation, the government has worked with the telecom operators and GPS tracking system. So look at again, third one is they have gone ahead with the GPS tracking system for the one who are home quarantine. Fine. And then they will get all the details with the telecom operators. Can you link something with India in regards to India has also gone ahead with Indian Telegraph Act 1885. Fine. And as per this, Ministry of Home Affairs can get or seek all the information of the individuals from the telecom providers, and from the telecom providers when they seek information, they can know from which tower the particular mobile is actually being operated. Thereby they can link or they can try to go and find out the one who have been escaped or jumped from the quarantine. So India also has gone ahead with that. So what is that? Indian Telegraph Act 1885, which was taken into consideration by India in regards to the GPS or telecom operators. And the one quarantine offenders, what I was talking about in India in regards to, that is, as I was talking about in regards to geofencing and also Arogya Setu app, in that both together I was also talking about the COVID-19 quarantine alert system. COVID-19 quarantine alert system. There also it is because of this whatever I've said in regards to the GPS, in regards to identifying the tower with the telecom operators, with the DOT, making sure the one who have or offenders or the who have jumped from the quarantine camps, they will get to know or they will identify, they'll go back to the respective place, track them, and then get back them, and then treat them, and then they test them, and then they treat them. So quarantine offenders are subject to fines. So what is important is they have gone ahead with fines or mandatory placement according to relevant laws and regulations. So definitely India also has the laws and regulations. Please see, look at how I am trying to, what you say, have this kind of what Taiwan had, and then how India has also gone ahead. So India has also gone ahead with National Disaster Management Act, Essential Commodities Acts, Epidemic Disease Act, Indian Penal Code, and then Criminal Procedure Code. So India also has gone ahead with various acts, and also in regards to the geofencing or Arogya Setu app, in trying to link or identify the offenders. And then Taiwan has also increased laboratory testing. Yes, in regards to India also, initially it was in regards to the National Institute of Virology which was going ahead with the testing, and later on ICMR has given almost the permission close to 60 plus, or now it is more than that, 70 plus laboratories are going ahead with the testing. So look at it, we are definitely having some kind of Animesh Bharadwaj has also joined. I would say hi to Animesh Bharadwaj. We are discussing about the Taiwan's coronavirus protocol, or else the strategy they have taken into consideration, how to restrict the virus, and then how they have used the technology to restrict the virus. Various methods. Pratham says that can we say community care management system is a path setting example in grassroots democracy and policy implementation? Yes, definitely we should have this. That is what I one of the classes I was talking about, the role of community engagement. In this I was talking about the ASHA workers, role of community engagement. So here I did take a lesson itself, 1 hour or 1 hour 15 minutes on the COVID-19 and role of community engagement. That is very important. Yes, and it has also increased the laboratory testing capacity, wherein its scope of surveillance inspections based on the trends of the COVID-19. That is the way we are. India is going ahead with the hotspots or non-hotspots. Fine. Again, in hotspots areas, we are looking at the zones we have looked at. That is in regards to the green zone, orange zone, and red zone. So definitely the surveillance capacity would be on the scope of its surveillance inspection based on trends of which area the virus is spreading virulent. And then Taiwan has also not just gone ahead with testing, but it has gone ahead with the retesting. Retested people who are with higher risk, who have already tested negative. So this is what it is. So retesting is the one which is also very aggressively taken up by Taiwan, and that is Taiwan's coronavirus protocol. Part of it, retesting is part of it. The one who have this severe influenza or community cases in regards to respiratory tract infection, because SARS is the one which is a respiratory disease. It is a respiratory disease. SARS attacks the respiratory tract, and it is a respiratory disease. And Taiwan has designated 50 regional hospitals and medical centers and 167 community hospitals and clinics to create a tiered system for testing. This is what is important. So it has a very structured system of testing. And probably India, because of its density population, and then the infrastructure in regards to the health is very big. Not only infrastructure in regards to the health, but also the contribution expenditure onto the health is also very big. So probably the structured system of testing could not be possible, but definitely the government of India is striving very hard to make sure that all the possible efforts by the PMO, by the health ministry, by the home ministry, by the ICMR, by the state chief ministers, and the administrations, municipal, doctors, everyone are combined together, coordinated effort, and then they are making sure that there is a system place in for the testing which is happening. And then even they have the hospital and clinics wherein they have the special wards, and that is even in regards to India is gone ahead with taking into consideration not only hospitals, but it has gone ahead with making sure that many hostels are vacated. Fine. And then we have seen many the government offices which are bigger in size, larger in size, like stadiums, I mean indoor stadiums I'm talking about, indoor stadiums. And also in regards to the, we have seen even trains were also converted into the testing hospitals or clinics. So that is also, and which wherein India has also followed it. And Taiwan has banned the export of surgical masks since January 24. But we cannot go ahead because it it is gone ahead with the internal production, requested requisitioned masks, and expanded domestic mask production. This is very important. But India, yes, we have to go ahead with the domestic production, but also as the what do you say, from the imports also we have to go ahead. Sir, one of the problem is that we don't learn from our mistakes. Okay. Well, yeah. And in fact COVID-19, COVID-19 pandemic is a blessing in disguise. It is really ruining our life, but it is also a blessing. What we have to learn? What is a blessing? We have to learn. And what you are saying, Bharadwaj, yes, definitely. If we are not learning, then we will be, I mean, humankind will be, I'm saying, will be wiped out by a microorganism, microorganism. And that is what is important, that we need to learn. We need to learn. Yes, we need to shift towards natural innovation. We need to learn. We need to learn to live with virus. We need to learn to live with virus. We need to learn to live with virus is very, very important. Natural innovation. And February 6th, Taiwan has launched a name-based rationing system. Look at this, name-based rationing system for mask purchase. That means you will be given a mask. You can procure a mask. You can purchase a mask, but you will have a name-based rationing system, wherein there will not be, I mean, there will not be a kind of, what do you say, a demand for particular mask, and then immediately you will have the shortage of the masks. And it has added ordering system for masks. So first is in regards to the name based rationing system. That means you will have only specific masks, not the way you can go ahead with bulk mask purchase. And then later on they have gone ahead with ordering system for mask ordering, wherein you can order later on from March 12th. So February 6th and March 12th. That means during this time the containment of virus has taken into consideration. And then this is in regards to online, and you can pick up mask at very your convenience stores. So definitely the technology is definitely used here, again trying to make sure that they are name based rationing system and then ordering system through online and then you can go ahead with picking up the mask whichever you have ordered in your at near your convenience stores. And then now we'll link the global linking and beyond. That means how Taiwan has not only worked for the containment of virus for itself, but it has gone ahead with how it has helped various other countries also. So the global health security requires the efforts of every person. So definitely the COVID-19 or SARS-CoV-2 has has taught everyone that what is important is coordinated effort is important. Coordinated effort is important. That is what the COVID-19 has taught us, or SARS-CoV-2 has taught us. And that will only have the optimum response to the public health threats and challenges. So what are the threats and challenges is in regards to the SARS-CoV-2. Now, fine, or it's specifically virus or specifically zoonosis virus from the animals. So what is important is it requires the effort of every person to ensure optimal response to public health threats and challenges. So when we are talking about public health threats and challenges, so for to overcome or to make sure that we are effectively overcoming the spread of virus, or we can make sure that the break of transmission of virus take place only through coordinated efforts, and that is very important. But we have seen few countries like USA trying to have again that trying to have this coming up with new theories, or the blame game theory onto China. Okay, never know whether it is a lab cultured one, because US agencies have also said that it is not lab cultured, but it is a natural phenomena. But still US president is going ahead. So now what is important is Such Aarti is also has joined. Good morning. A very good morning to you, Aarti. And today we are talking about Taiwan's coronavirus protocol, how they have contained the virus effectively, and what are the strategies they have taken, and what technology they have implemented to contain the virus, and how Taiwan has been part of the global, I mean, all the countries setting as an example, and how they have also been part of the global challenge or global health security itself, part of the global health security. So we are discussing that, Aarti. And Taiwan has been, we know, as I said initially, it has been excluded from the WHO for various political consideration, but still, even though Taiwan is not a member of WHO, it has fulfilled all its responsibilities as a global citizen. This is a, what you say, keyword which you need to understand. We always talk about the citizen of a country, fine, but here Taiwan has fulfilled its responsibility as a global citizen. Yes. Bharadwaj, yes, this is a whole diplomatic game and egoistic policy. Yeah, definitely. So we have to come out of that. We have to come out of that. We should stop going it with any, I mean, coming up with a new theories or a new blame game theory. We should move out of it. And then the core importance of the need of the hour is to fight against the coronavirus or SARS-CoV-2 or COVID-19, and then effectively be a winner, be a successor against the pandemic, and make sure that we will experience minimal effect in the future. I'm saying that is very important. And then it has acted as a responsible global citizen and abided by the international health regulations 2005. So IHR 2005, even though it is not a member of WHO, excluded from WHO, fine, but still it has acted as a responsible global citizen, and it has also abided by the rules and regulations or terms and conditions of International Health Regulation 2005. Again, this is prelims point of view. International Health Regulation 2005 in notified WHO are confined COVID-19. So Taiwan has communicated. Now, if you look at it, it has also, what do you say, not just trying to go ahead with various strategies and then come up with harnessing its technology to contain the virus or having its own protocols, but it has, even though it is not part of WHO, even though it is not a member of WHO, it has communicated to other countries such as Japan, Republic of Korea, Singapore, Malaysia, Philippines, United States, Canada, Italy, France, Switzerland, Germany, UK, Belgium, and Netherlands, as well as European Center for Disease Prevention and Control. For the European Center for Disease Prevention and Control. So look at the way it has, what you say, gone ahead with taking as a global citizen and as a global leader itself. Please do understand, as a global leader itself, it has communicated to all other countries. What it has communicated? To share information on the confirmed cases, travel and contact histories of patients, and border control measures. Please look at it. The way, that is why the Taiwan coronavirus protocol has taken the kind of importance in the newspaper, and not only in the newspaper, it is definitely to be taken in the, what you say, entire globe, the way it is, and it has communicated to various other countries. And that is why, not only just to what you say, the Southeast Asian countries or Asian countries or West Asia, but also it has gone ahead with US and also Europe also, US and Europe. Not only that, again, in regards to the European Center for Disease Prevention and Control, so it has passed information to us. Now I'll read what Bharadwaj says, sir, but still we are not learning. We should learn from Kerala and seek its assistance. Yeah, definitely we have to learn from our mistakes. We have to learn from our colleagues. We have to learn from our neighboring districts, neighboring, what do you say, neighborhood, first neighborhood, neighboring districts, neighboring states, neighboring countries, and also the one who can really provide us information. We have to learn that. And also the state, when I was talking about, yes, as you said, Bharatwaj, in regards to how Kerala is effectively trying to contain the virus, we need to look at. And Pratham says that Taiwan has a major role in playing PPP pool in future. Yes, definitely. Pandemic patent pool. And Satya says that Taiwan must be included in WHO after playing such kind of roles continuously. Absolutely, said Satya. Absolutely. Hope it will happen. And Taiwan has uploaded the genetic sequence of COVID-19 to the GIS ID. This is again very important for prelims. What is GISA ID or GISAID? You can also call it a GISAID. That is Global Initiative on Sharing All Influenza Data. Global Initiative on Sharing All Influenza Data. So even though it is not part of WHO, it is part of International Health Organization, which has come up in the year 2005, and it is also uploaded or shared the genetic sequence of SARS-CoV-2 to Global Initiative on Sharing All Influenza Data. And Taiwan has worked with global partners to respond to the threat of in regards to the global health. And this is also making sure that it is not imperiled by lack of communication and transparency. So what is important is that coordinated efforts I was talking about. Coordinated global efforts is very important. Fine. Sir, our way of thinking world is our family, but do we implement in our country? That is what it has to start from the family itself, individual family, homes, respective homes. It has to start, and then it has to be in the neighborhoods, community, and then in regards to the district, and then in regards to the states. Then only that kind of attitude or that kind of mindset will develop, and it has to develop. Jahnavi says China claims that Taiwan is its province, so it can't represent itself independently. Absolutely. Absolutely, you are saying it right. Absolutely. State within state. It is a state within state. And then now we will look at Taiwan and WHO. As Satya was saying, it should be considered. But how and what basis? And how China will definitely be as a stumbling block for Taiwan to get into WHO or be a member of WHO. And since long time it has been excluded from WHO due to political consideration, as I said, and Taiwan could share the world thanks to its renowned public health experience. It is having an experience, as I was talking about, that 2003 SARS-CoV-2. It has improved its public health, it has improved its health system and the national health information also, and then ability to perform rapid testing. This is also very important. That means it has experience in regards to rapid testing and also in regards to research and manufacturing vaccines. This is the most important. Research and manufacturing of drugs and vaccine against COVID-19. So look at it, the way it is having its sway, its control since in 17 or 18, 17 to 20 years, the way it is gone ahead with varied experience, health system, and in regards to rapid testing, and then in regards to manufacturing of various drugs and vaccines, and then WHO should not neglect. Now, what you were saying, Satya, now the point has come. WHO should not neglect the contribution of global health security of any nation. If you look at the Taiwan also, so here you look at WHO is ill. Who is ill? It's not Taiwan. What they say is it is not Taiwan. Look at this image. Who is ill? WHO is ill. And then we are ready for WHO. Taiwan for WHO. Is it Taiwan for WHO or WHO for Taiwan? Is it Taiwan? Is it Taiwan for WHO or WHO for Taiwan? The time should decide. Arti says WHO is ill. Okay. United Nations Sustainable Development Goals. Yes, very well said. Yes. Satya says if the China would upload the information of COVID-19 earlier, as Taiwan did, the situation would have been much better. Absolutely taken noted. Yes, definitely, definitely. Probably a little bit of what you say earlier reaction from China would have been better. But okay, we would talk now, but we seriously do not know what the situation was then. Whatever it is, if it could have been better if the information has been passed to the WHO in regards to the virus and also the sequencing of the virus. Yes, China also shared the sequencing of the genetic sequence of the COVID-19. And then Taiwan urged WHO and related parties to acknowledge Taiwan's long-standing contribution to international community. So it is urging WHO. So what Janavi, you were saying that China will not allow. Yes, China will not allow, but looking at all this, probably the international community will come into the forefront of trying to make sure that Taiwan is a member of WHO. But again, I'm saying it all depends upon block, how China will block Taiwan to be the member of WHO. And Taiwan continues to work with the rest of the world to ensure that enjoy the fundamental human rights. Look at the way it is. Global citizen, it acted as a global citizen, it is working with the rest of the world, it is sharing information to the rest of the world, fine, and then it is also wanting to enjoy the fundamental human right to health as stipulated in WHO constitution. Look at it again, this is very important for prelims and for mains point of view. For prelims, which among the statement is incorrect as per WHO constitution? What does the WHO constitution says? That enjoy the fundamental human right to health as it is stipulated in WHO constitution. It is. Pratham says best part of is the author of the article is, yeah, he is the health minister. Yes, yes. Health and welfare minister. Health and welfare minister of Taiwan itself is the author of the author of the article, that is Taiwan's coronavirus protocol. Health and welfare minister. And conclude, we will conclude it now saying that echoing the mantra of United Nations 2030 Sustainable Development Goals. United Nations Sustainable Development Goals. How many are there? Please let me know. How many sustainable development goals are there? Please let me know. No one should be left behind. Yes, that is the conclusion. It is indeed WHO's mission to ensure the highest attainable standards of health for every person. Then WHO needs Taiwan just as Taiwan needs WHO. So both require both. Each one of them require the other. Taiwan requires WHO. WHO also require or needs Taiwan. I did ask to the one overall watching how many sustainable development goals are there, because you have said the SDG 6, and I also mentioned here as per the United Nations 2030 sustainable development goals. It is WHO needs Taiwan or Taiwan needs WHO. Both of them, Taiwan and WHO, both have their own individuality, their own protocols, their own standard of strategies, technologies, and what is important is, as I said in the beginning, coordinated effort or massive coordinated effort or massive global coordinated effort is the need of the massive global coordinated effort is the need of the hour for the WHO and also for the Taiwan. And I've asked you, I don't know how many of you are there. I've asked you how many sustainable development goals are there. Okay, fine, you did not. 17 SDGs in total. 17. Uh, Bharadwaj says, sir, what I think that we should do innovation in farm sector also, because as of now we wait for new virus to emerge and then we act. Yes, definitely. See, and new virus as per United Nation Environment Program, what they say is the next 60% of the diseases will be from the, what do you say, from the zoonosis, and amongst this again 70% would be from the virus itself. Virus, not from bacteria, not from fungi, not from parasites, but from virus. So definitely, as yes, Janavi very well said. 17, yes. And so definitely we have to learn from the mistake and then we have to go ahead with how best we can try to overcome this or fight against the SARS-CoV-2 now, and then make sure that we are also well prepared for the future pandemic. We are well prepared for the future pandemic is very, very important. And I feel this was very, 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 or prior to that, I will go back to this once again. That is Taiwan's coronavirus protocol. Taiwan's coronavirus protocol is definitely a trending topic. I'm saying is definitely a trending topic and very, very useful for factual and analytical for prelims. And in regards to descriptive, we have n number of points. We had n number of points to write a, what do you say, an answer. Come link it, or what do you say, you have that in collaboration or in linking with the yesterday's class, that is pandemic patent pool, and then link it with the Taiwan's coronavirus protocol. You will have a best answer. And yes, Taiwan is tackling. Yes, Taiwan had tackled COVID-19 very well. Thank you very much, Pratham. Also, so please go ahead with the, I think this was informative, knowledgeable for prelims as well as mains point of view. And then please do like the video, subscribe the video, share the video. Please do not forget to share the video. Please do not forget to share the video. Hit the bell button, and then when you're watching the Let's Crack UPSC CSE English YouTube channel, go ahead with subscribing using my code SBT10. If you haven't subscribed the Let's Crack UPSC CS English, please go ahead with subscribing the code with my code, that is SBT10, for 24 months. Because for 24 months you will be actually paying effectively the amount of 13 months subscription, and you will be benefited to have subscription for 24 months. And if you haven't still downloaded the Unacademy Learners app, please go ahead with downloading the Unacademy Learners app, because you can have the access to Unacademy special classes, not UNSC, not United Nations Security Council, but you will definitely, if you have this, if once you clear, you never know, tomorrow you can also be part of UNSC as a IFS, Indian Foreign Service. You can also have the access, not on, by having access to Unacademy special classes, you will, once you clear the service, you will definitely have access as an IFS officer, foreign services. You will have access to United Nations Security Council also. So from UNSC to UNSC, from Unacademy special classes to United Nations Security Council as an IFS officer. So go ahead with subscribing using my code SBT Sandeep Bhushan Thummala 10 and you will get 10% discount. So Pratham, definitely. Then why can't you join? What do you say? Unacademy special classes, or it could be what do you say? Part of the subscription itself. You would definitely have that dream fulfilled. Bharatwar says us, thank you. Yeah, thank. And then see you tomorrow. See you tomorrow at 10 o'clock in regards to the newspaper analysis, and then again 11 o'clock trending topic. 10 o'clock newspaper analysis, 11 o'clock. 10 o'clock is newspaper analysis, and then 11 o'clock, 10 a.m., 11 a.m. 11 a.m. is trending topic. Trending topic. Fine. Okay, okay. Would be waiting for you, Pratham, in the Unacademy subscription. And thank you very much. See you tomorrow at 10 and again at 11 with the trending topic. Thank you all.